Okay, and we're going to get started. I'm Jennifer Wolf. Thank you for coming today to this Lunch and Learn hosted by the Senior Committee at the Lucas County Board of Developmental Disabilities. We're going to get started here just momentarily, but if you can put your name in the chat, that'll help with attendance. We will be offering continuing education for DODD, for provider training hours, as well as social work and counselor. So it's helpful to put your name in the chat for us. And we're excited to have Rachel here today. I'm going to let Jason go ahead and introduce, and I'll be watching the chat in the waiting room here. So thanks for being here, and Jason, go ahead.
All right. So I'm excited to introduce our presenter today. I had to twist her arm to do this for us. Just kidding. It's actually my wife, Rachel McAllister. She is a dietitian. She works primarily with people on dialysis in a renal setting, so an outpatient dialysis clinic at US Renal Care. She also works at Toledo Hospital with their dialysis unit, also working with a number of the other patients. So we're excited to have Rachel here to talk to us about nutrition for older adults. So I'll pass it to Rachel.
Thanks, Jason. Thanks for having me. So just give you some information about nutrition for older adults. If you guys have any questions, feel free to ask them in the moment. We won't wait till the end for that. And I just have to point out that when I made this presentation, 6 computers before, because I'm not very good. I mean, well trained on the Zoom calls. We don't do that often. So they were bullet points, not lips. But, might as well leave those in there for entertainment purposes. So eating, lips, mouth kind of go with it. Okay, so aging population in the United States. Age 65 is used to define the transition between middle age and older age. So that's what we're going to go with. Age 65 years and older is what a lot of the recommendations are for older adults. So in 2019, 16% of the US population was over the ages of 65. And then by 2035, the US Census Bureau is projecting that there could be more adults over the age of 65 than there will be children under the age of 18. So that's just interesting to think about, and that's not very far away. So by 2050, they expect that almost 22% of the population will be over the age of 60 years old. So population's going in that, people are having less children and all the adults are getting older. So just kind of makes sense that that would be happening. So for nutrition, for your diet, as you get older, there's a couple goals that I would say are priority. So helping to lower disease risk. If you know that your family has a history of diabetes, hypertension, cancer, then there's a chance that you can modify your diet and help to decrease your risk of getting that disease or that condition. As you get older, you want to increase your quality of life. So enjoying the foods you eat, but also avoiding foods that maybe you can't tolerate or that cause issues for you when you eat them will help to increase your quality of life. So calorie needs decrease by about 5% every decade after the age of 50. That's due to decreased physical activity, decreased muscle mass, and slower metabolism. So making sure that we're choosing foods wisely to avoid weight loss or weight gain, either one. The Dietary Guidelines are published by the USDA every 5 years, and they modify the ones that were presented before that. So the ones that we're using right now are for 2020 to 2025. And those are based on eating patterns across the United States, research, and they set out a couple goals that they want to focus on and then go more in depth for all of them. So there's here, follow a healthy dietary pattern at every life stage. So that's focusing on from birth to 65 and older. They have recommendations for each of those age ranges. Enjoy nutrient-dense foods, which I just want to stop there. Nutrient-dense food is a phrase that is very important. Choosing foods that provide more benefit than they do negative effect to your body is a nutrient-dense food. So very important. And beverages based on, so enjoy nutrient-dense foods and beverages based on preference, culture, and budget. So I'm not going to tell you to go eat sushi for every meal or every day if A, you don't like it, B, it's not widely available in your culture. You know, you can't walk down to the corner and get some fresh sushi, or C, if it's not affordable for you. So making sure you're picking foods based on all those options, and then focus on meeting food groups needs within calorie limits. So, you know, I'll explain later how to figure out how many calories that someone needs, but you want to make sure you're meeting your needs within that calorie range. So getting what you need without getting too many calories. And then limiting food and beverages high in added sugars, saturated fat, and sodium, and limiting alcoholic beverages. So this shows the recommendations for each food group at each calorie level. So about 2,000 calories is what we generally say for the average adult, but as we get older, we need less calories. So I would say between 16 and 1,800, just as a general recommendation. So you can see for 1,800 calories a day, we recommend 2.5 cups or equivalents per day of vegetables, 1.5 cups of fruits, 6 ounces of grain. So like 1 ounce of grain is a piece of bread, 1/2 cup of cooked rice or pasta, 1/2 cup of cereal, 3 cups of dairy a day, and then 5 ounces of protein. So ounce of protein is about, it's like 1 slice of deli meat or 1 egg or 14 almonds. And then specifically, like a small chicken breast is usually about 3 ounces. So just to kind of put that in perspective. And then they recommend oils because everyone needs healthy fats. So getting about 24 grams of oil per day, which is not very much. And then you can see at the bottom, it limits 140 calories for other uses. So, you know, not nutrient dense foods, whether that's empty calories, sugary beverages, desserts, anything like that. So this shows you the comparison that is the average intake for older adults versus what's recommended. And you can see vegetables, fruits, dairy, all well below what the recommendation is, the intake is, but men usually meet the protein intake needs. And then also grains is not hard to meet either. So right about there. So to calculate your calorie needs, your BMR or your basal metabolic rate is what your body needs at resting. So if you're doing nothing but sitting there, your body still uses calories. So the Harris-Benedict equation is pretty good. It uses age, it factors in age there. So we usually use that for older adults. But if you don't want to do that big calculation there, the quick and dirty method, we use 25 to 30 calories per kilogram per day. So for a 130-pound little lady, she needs about 1,475 calories to about 1,770 calories per day. So not very much, but you know, it's plenty. Protein needs for older adults. So they need things, I mean, we all need things for protein for things like maintaining muscle mass, your immune system, fight infections, help wound healing, and then also to produce and activate enzymes and hormones that are used for digestion and many other things. If there's an illness or surgery, then you need more protein. So about 0.8 grams protein per kilogram per day is the general recommendation. Some people with wounds or certain diseases need up to 2 grams of protein per kilogram per day, which is quite a bit. So 0.8 grams per kilogram is about 47 grams in a 130-pound female. So 6 ounces of chicken breast will pretty much take care of that with an egg. So incorporating protein at every meal, 3 meals a day, pretty easy to get that in. So, you know, think about if you go out to dinner, you get a 6 ounce, 8 ounce, 10 ounce steak. That's plenty of protein that you're meeting at just 1 meal. Sarcopenia is muscle loss that happens from aging, disease, inflammatory conditions, sedentary behavior, whether it's bed rest with a broken leg or just not able to move, limited mobility in the first place, and then malnutrition. I just want to point out here, under malnutrition, it can be undernutrition or it can also be overnutrition. or obesity. So just because someone is eating plenty of calories doesn't necessarily mean they're getting enough protein or other nutrients to support your body, your muscle mass. So very easily lose muscle mass there. So this shows muscle strength compared to age. So peak muscle mass is about 20 to 30 years old. And then you can see it just slowly declines after that based on age, just naturally. Grip strength is also something that we use, a lot of physical therapists use this to assess muscle mass. So you can see males and females, it declines after about 30 years of age. And both of those two things are things that we use to identify malnutrition. So malnutrition is identified by two different assessments. You can use the subjective global assessment, just ask a bunch of questions, you kind of check them off, or the mini nutritional assessment, which is more appropriate for older people. But again, quick and dirty method, we use this in the hospital. They ask this to every patient that gets admitted regardless. If they've had poor PO intake, so if their oral intake has decreased by 50% prior to admission, or if they'd had any unintentional weight loss over the past 2 weeks. So if they answer yes to both of those, then there's a good chance that they're at risk or already malnourished. We also use a nutrition-focused physical assessment, so looking at their collarbones, their cheekbones, their eye fat pads here, using the grip strength, measuring their muscles to see if there's any fat or muscle loss that can contribute to malnutrition. So just kind of think in your head, what percentage of older adults do you think are malnourished? So about 12 to 50% of hospital older adults are malnourished, again, based on those assessments that I mentioned. And then about 23 to 60% of institutionalized older adults, so whether they're at a nursing home or a skilled nursing facility or a group home, they are at risk for malnutrition. And then just contributing to hospitalizations, about 34% more costs are related to malnourished patients in the hospital. So if they're malnourished, they're more likely to have less wound healing, more infection, their strength isn't well, they can't go home, so longer hospital stays. So it can lead to changes in activities of daily living, again, increased healthcare costs, weakened immune system, decreased bone mass and wound healing, and then increased morbidity and ultimately mortality. So a couple specific needs for older adults are here. We'll go through these. Vitamin A is actually, it's fat soluble, so it's stored for longer periods of time in the body. So the needs decrease with age. But because of that, toxicity is actually pretty likely, can be likely with vitamin A supplements, because, you know, you think, oh, I can't see very well, I need vitamin A. They go buy supplements, not taking the recommended amount, or, you know, usually people think more is better. And their body stores it up, and they can become toxic. So beta carotene is a better option to supplement. It's a precursor to vitamin A, so it's not fat soluble, but it's not easily overdosed because of that. Vitamin A helps with visual pigments. It helps with gene regulation, growth. It helps with skin. So a lot of people who are deficient in vitamin A have night blindness. They have changes in skin texture. People with eczema, usually actually they test their vitamin A levels and they can be low, and then also poor growth. So the DRI is a dietary reference intake, and that just gives you a recommendation of how much you should take per day. So over 50 years old is 900 micrograms for males and 700 micrograms for females. And then the tolerable upper intake level is 3,000 micrograms per day. So that's the level that is safe to take without toxicity. So anything over that, you could become toxic for it. You don't exactly need to remember the numbers or anything, but you know, if someone is in need or deficient in any of these nutrients, then it's good to go back and look at what the recommendations are, so that if supplementation is needed, then you'll know where to go from there. Food sources for vitamin A, all the orange vitamins or fruits and vegetables. So carrots, sweet potatoes, pumpkin, squash, mango, cantaloupe, those are all contain vitamin A. And then also ready to eat cereal is a great source of any nutrient, quite honestly. They fortify the cereal, so it has lots of vitamins and minerals in there. And it even tells you right on the box exactly what percentage of it that is in the cereal. And I don't mean like Lucky Charms where you eat all the marshmallows, like Cheerios, non-sugary cereals. So you'll see that in a lot of lists. Iron is the needs decrease for women after menopause.
Rachel, can I ask a question?
Yep.
Do people, is it back on the other one you said, like the tolerance, are people have too much vitamin A or any vitamins often? Like, is that a common thing to have too much of any particular vitamin?
I wouldn't say it's common, but it is, it's not super uncommon for people to either come in the hospital or, see the doctor and say, this is going on, I've been taking these medications. But the fat soluble vitamins, it's more common because, like I said, they are stored for longer, they're stored in the fat as opposed to water soluble vitamins, which are excreted in the urine. So they are stored longer, so it can happen. I wouldn't say it's very common in, in America. Good question. So iron, it's actually interesting because about 90% of iron is recovered and reused by the body every day. So what you have in your body, 90% of it is reused, and then you get the other 10% from what you eat. And interestingly, even though you need only 10% from your diet, many people are deficient in iron because they either, but with the wide availability of iron fortified foods, it's just interesting that people have iron deficiency or iron deficiency anemia, pretty common. So there's heme and non-heme sources of iron. The heme sources are the food animal products, so red meat, poultry, fish. And then the non-heme sources are like plant-based or fortified cereals, beans, spinach, nuts. Those are good sources of iron. Iron actually needs vitamin C to be absorbed. So if you're not getting enough vitamin C, which is not common, then your iron isn't absorbed very well. So like you'll see if they serve a steak at a restaurant, they'll usually put a little orange slice on there. So just take a little nibble out of the orange slice to get your vitamin C to help you absorb your iron. Vitamin D needs increase with age. So you need vitamin D to help with calcium. It also helps with a lot of other hormones. And you get half of it actually from the sun. So sun helps to synthesize vitamin D in the skin. But living in Northwest Ohio, many people don't get a lot of sunlight exposure. Also, if with age, you aren't outside as much. So vitamin D is usually something that people are deficient in. And there's been a lot of research in the past couple of years on vitamin D. Quite honestly, I recommend most people probably should just take a vitamin D supplement if they live in Northwest Ohio. But there's benefits for cancer, cognitive health, bone disorders, MS, osteoporosis, psoriasis, and rickets, which rickets is not usually around too much. But all of these conditions have been found to people that have it. Many of them are deficient in vitamin D. So, and then vitamin D, it comes in 5,000 unit tablets. So you can just take that once a week. And because it's fat soluble, stored in the body a little longer, that's usually sufficient. You can get vitamin D from, again, fortified cereals, milk, eggs. Orange juice is actually fortified with vitamin D. So that's a good source of it. And then liver, salmon, and tuna are good sources as well. Vitamin B12. So about 15% of older adults are deficient in vitamin B12. That's another one. Has a lot of symptoms and it's usually supplemented. So fatigue, headaches, depression, inflammation of the mouth and tongue. You can actually see that pretty well. Swollen tongue, bright red. So if someone is taking a proton pump inhibitor, it'll decrease the stomach acid, which actually vitamin B12 uses the stomach acid to release it from food as part of digestion. So if it's not released, it's not going to be absorbed. And then also it needs something called a protein called the intrinsic factor to be absorbed. So people with pernicious anemia, kind of the body's immune system cells attack the protein in the intrinsic factor, so that decreases absorption as well. So B12 can be supplemented either with a shot, which is common depending on which deficiency you have, or with a pill as well. But it's water soluble. So if you do buy a supplement, not more is not always better. You literally are excreting it via urine if you're not using it all. So you might just be paying for more of vitamin B12, but not using any of it, literally going down the toilet. So calcium needs increase with age. Many older adults do not consume enough calcium. If you think about it, calcium is found in a lot of dairy products. So many older adults are lactose intolerant, so they stay away from all dairy products. So that really decreases their options for sources of it. So some other sources of calcium, dark green leafy vegetables and canned salmon. Actually, like within the bone, canned salmon has bones in it. So usually that's where the source of calcium is. But if you're lactose intolerant, you more than likely can tolerate yogurt or some cheese products. So really getting them to try that, or even like almond milk, soy milk now is fortified with calcium too. So another option. Fiber is very beneficial. So there's soluble and insoluble fiber. They both have different functions, but very beneficial to help decrease fat absorption, monitors or stabilizes your blood sugar, helps decrease your risk for cardiovascular disease by decreasing your fat absorption, and then also prevent constipation, and then lower your risk for GI cancers and diseases. So good sources of fiber. We all know beans, berries are a very good source of fiber, apples, or any fruit or vegetable with the skin on them, really, whole wheat products, and then bran cereal and raisins. So with increased fiber intake, more water is necessary, but also your body just needs water really more than it needs food. So older adults need about 48 to 64 ounces of fluid per day. So if you think about how much you drink in a day, you probably have to be intentional about getting in 64 ounces of fluid a day. So having an older adult who may not be able to get around as easily, maybe they drink more coffee, which is a diuretic, so they lose a lot of fluid during the day. It could be very difficult for them. So their needs for water, about 1 milliliter per calorie per day. So around like 1,600 to 1,800 milliliters a day, which again is about 48 to 64 ounces. Dehydration is a huge problem for older adults. So the body water just naturally decreases with age because of muscle loss. Medications that they take can cause water loss, probably intentionally if they're taking like a diuretic for their heart, but also they're losing that water, and they may mentally think, okay, I need to drink less. So sometimes it's just even not enough then. Your thirst mechanism is not as effective, so you may not realize you're thirsty until it's too late. And then also, again, decreased mobility to get to fluids. If you're sitting there with a bottle of water and you drink all of that, they may think that they're not going to get up and go get more. So that's all they're drinking in a day is 16 ounces. So an easy test for dehydration is if you can see, pinch the back of the hand, and if the skin stays up, then there's some degree of dehydration there. So here's the levels of dehydration. So first it starts out with thirst. And again, if their thirst mechanism isn't as active, then they might catch it at the next step, which is already about 5% dehydrated. Dry mouth, fatigue, headache, and then your body's temperature starts to rise, your breathing increases, and your pulse rate increases. Could lead to dizziness, weakness, or even more labored breathing. You get a swollen tongue, you become delirious, muscle spasms, and then poor blood circulation because there's just not enough fluid or volume in your body. So then that can cause to lead to kidney failure. and then eventually death after that if it's not caught. So with vitamin, someone have a question?
Yeah, can you drink too much water or have too much water? What does that do?
Well, you can actually. It'll cause your sodium levels to be decreased, which can mess with your brain function. I'm sure that level is different for everyone, and it's pretty common in people with mental health disorders. Actually, I've seen it in the hospital. So yeah, just monitoring that, putting a limit on that somehow would be good, because it, like I said, it can cause issues with sodium. Potassium can become horribly, what's the opposite of concentrated? Low, and that can mess with your heart. So yeah.
Thank you.
So vitamin mineral supplements, kind of asking, you know, at what point do you need to supplement? Well, variety and balance can help you to not have to supplement, making sure you're getting a variety of different colors in your foods. So, you know, like I said, the orange fruits and vegetables are where you get vitamin A from. Green fruits and vegetables, you get a multitude of vitamins and minerals. Red provides a different set of vitamins and minerals. So making sure that you have some color. And then, but, you know, sometimes older adults aren't able to eat as much. They're not able to have access to fresh fruits and vegetables. So they may need a supplement. Like I said, more is not always better. And taking a multivitamin, like a general multivitamin mineral, is a better option, unless you know you're specifically deficient in one vitamin. So if you know you're vitamin D deficient, take that. Otherwise, just take a general, unless you're instructed by your doctor. And then because you're taking a multivitamin, it doesn't make it okay to not have fruits and vegetables. You know, it's a supplement in addition to the food that you eat, not a replacement for the food that you're eating. So factors that affect intake, a lot of physical changes that affect what a person eats as they get older. So they have loss of muscle and decreased bone mass, which can contribute to a lot of factors, but, you know, not able to physically prepare meals, stand at the stove. Maybe they can't carry groceries in like they used to anymore, and they don't have any help. So they're going to get one bag of groceries that they can carry in, maybe in each hand or just one at a time. So that really limits what they buy at the grocery store. So loss of muscle and decreased bone mass they don't have to happen. I mean, yes, sometimes in general they just do, but increased protein intake and strength and resistance training can help to prevent or at least maintain where they are. Even something simple as walking, or sitting in the chair and lifting a weight or lifting your legs can help to just keep the muscle, because if you don't use it, you lose it, whether that's your leg muscles, your arm muscles, your like throat and mouth muscles. So you got to continue to work those.
Hey, Rachel.
Yep.
Just a curiosity question, because it looks like you're kind of moving to a little different topic. When you're talking about all the different, like the multivitamins and that kind of stuff here, now I went there because I take a multivitamin every day just to help keep things, make sure I'm getting what I need as a supplement. But, you know, I'm looking at this label and almost everything on there, like there's even one of them that has 353% of what you need. You know, it's like almost all of them are over 100%. There's some that aren't, but is that just why do they put so much extra in if it's more than what you need?
Yeah, so some of those, honestly, it's the fact that they can say, well, we tripled what you need here, so we can charge you more for it. Some of those are things that people are generally low in, so they know that you just need a little bit more repletion. So if it's like specifically for a older male, you know, they might give you more zinc or more B12. But yeah, again, a lot of those are just water soluble. So you are literally just using what your body needs and getting rid of the rest of it through urine. So some of those, like folate, they usually put a lot of folate in things, which is fine. But it's just not really necessary all the time. So most of them will not hurt you if you have too much, like I said, but with the A, D, E, and K, those are all fat soluble, so you can have too much in your body.
Are there other vitamins that people shouldn't take that, I mean, obviously you're not gonna be able to say specifically, but like, because some of them you can get just the one vitamin or just the one supplement. So you can take too much of those, right?
Yeah, you can. And like I said, I would only recommend those if you know you're deficient. You can get tested, or if you're showing specific signs of deficiency, then that's fine. And a lot of people take those hair, skin, and nails, which is all like B vitamins basically, which help with your hair, skin, and nails. So if you're having an issue, obvious, then those are okay to take. But otherwise, I wouldn't take them unless you know you're deficient. Okay, so another thing, another issue with physical changes as you age is oral health. So loss of teeth, poorly fitting dentures, gum disease. A lot of times if people lose weight, which if they're eating less and they're getting a little older, then their dentures start to fit differently. And they can't wear them when they're too big or too small, or if their gums are swollen because of a different issue. So then they'll just choose to eat foods that are a little softer that their teeth can tolerate, which really limits their protein and their vegetable intake. So they're missing out on a lot of nutrients that way. And then also decreased production of saliva. So your teeth and your saliva provide the first step in digestion. Your teeth, mastication, they start to chew the food up, and then saliva has amylase in it, which is an enzyme that helps to break down carbohydrates. So, if you're not producing enough saliva and your teeth aren't working appropriately, then you're not really breaking down your food, higher risk for choking, and also it might be more difficult, more pressure on your stomach. So you want to make sure you're moistening the foods when if you're not able to chew them as well, or for easier swallowing. Biotin is a good oral spray or oral spray to keep your mouth moist. Adding extra gravies and sauces, or taking sips after you chew food. So making sure you have a drink with your meals, and also chopping or pureeing foods as needed. I know some people shy away from doing this because, just it might kind of hurt their pride to have to do that. But if that's the way you're going to get your food in, sometimes you have to do it. And there's actually a lot of really great pureed products that you wouldn't even notice the difference. So, and then also pre-cutting foods. So chopping up some like a roast and putting it in a soup or a casserole where it's served with other foods that are really moist. And then obviously maintaining regular dental visits too. Also, so your intestinal secretions change, and you're not able to create as many acids and enzymes that you need within your GI tract to digest the foods. So that's where vitamin D and B12 supplementation may be necessary. Also having smaller, more frequent meals. If you're not able to eat a big full meal at a time, make a plate, cut it in half, and save it for a couple hours later, so that you're still getting in all the food that you would in a day, but just smaller, more frequently. And then constipation is a big issue. So the intestinal wall becomes weaker. It's not able to move the food down where it needs to go as easily as you get older. So changes with that can cause people to not eat as much if they're backed up. And also many medications can cause constipation too. So really having the doctor look at that, see if there's other options, or taking in, you do a fiber supplement, and pre and probiotics are really helpful in that situation as well. But also if you're increasing the fiber, like I said, make sure to increase the fluids as well. Taste and smell. So the number of taste buds and the olfactory cells within your nose decrease. So you're not able to smell and taste as you were before, which can really change how food tastes. I don't know. I've had a lot of patients complaining after they've had COVID that they've lost their sense of taste and smell. So they just are not eating, or they're sticking to the same food all the time, which can cause specific deficiencies in other nutrients. So really working with that. Also medications too can interfere and cause altered taste and smell. So talk with the doctor about those. But adding fresh herbs and spices to foods, even if it's just for color, you know, adding a little parsley in foods can really increase the flavor, but also make it look good and appealing. So a variety of colors, different shapes on your plate. If you're just serving French fries and fish sticks, you know, that's all one color, all one shape, not very appealing. So your appetite could be decreased because of that. And then also changing up temperatures and textures on your plates as well. Sorry, my throat's very dry.
I don't think our kids would agree that fish sticks and French fries are not appealing, because I'm pretty sure they eat those all the time.
I know. Well, that's why they take a multivitamin.
Okay.
So again, thirst with physical changes, decreased thirst mechanism, so greater risk of dehydration. So keeping fluids close by, whether it's even, you know, having bottled waters at each table next to the couches that they're sitting at, or even have a little cooler, you know, make it fun. Put a couple different beverages in there. Because if they're dehydrated, that can also affect their skin, and you know, skin tears are very common, which can lead to wounds. And then if you're dehydrated already, your wounds are not going to heal. So that can be a vicious cycle, especially with poor wound healing. Also, keeping fruits and vegetables that are high in fluids around. So I know I recommend frozen grapes to a lot of my patients to just help to keep their mouth moist, but also just to kind of suck on. And then eating the grapes, you know, you get a little bit of fluid out of that. Watermelon, peppers even have some fluid in them. So just keeping those on hand too. Eye health decreases. So cataracts, macular degeneration, and glaucoma can be big issues for the elderly. And with those, they're not able to see specific numbers on the microwave. So they may be, you know, cooking food way too long, which then can make it tough. Or the oven. It can be very dangerous. So making sure to keep their eye health, you know, eyes healthy with whatever they need for that. Using physical cues to help. So, you know, maybe put a star on the add 30 seconds sticker on the microwave so that it's easy to just quickly, okay, push that twice and here's what you got. Or highlight the temperature on the oven that they need to be at usually. Also, cooking multiple meals at once so that they knew, okay, I got to take this out of the refrigerator, put it in the microwave, push the star for twice, and then it'll be ready to eat. And then using one cooking method meals. So not having them put something on the stove and then into the oven and then, you know, frying it later. Just one method can help with that. Chronic medical conditions can also contribute to physical changes that can decrease their appetite or their intake. So thyroid disorder, you know, their sense of hunger can be differentiated. Also weight loss or weight gain can be common with that. Sleep apnea, if you're not sleeping well, it affects many things, but also you may have a dry mouth. So just acknowledging when you need to drink a little bit more. And then also all of these issues can lead to a loss of driver's license. So taking away their ability to go get groceries like they used to do, or to go out to eat like they used to do, can affect more than just their intake, but also their mental health as well. And also keeping a reserve of food supply on hand for sick days. So foods that are easy to eat, you know, pop it in the microwave, or finger foods, grab and go for when they don't feel well, or if the weather's bad and they normally go out to eat that day, just keeping something on hand so they have food to eat. Social changes. So, you know, eating is a big part of social events. So if they lose their friends and companions that they used to go to social events with, then that can affect what they eat and how much they eat. Or if they don't have their driver's license, can't access, you know, the senior meal or activities that they're used to doing, can really decrease how much they eat. So just a couple tips, you know, communicating with the person, just as good as in-person visits, kind of keep their spirits up. Coordinate social gatherings, change up the eating environment, you know, put flowers at the table so it looks like something they want to go to, or eat in a different room, take them outside. Serving food attractively, put it in nice dishes. And then also having them involved in meal preparation and planning. You know, I did some hours for my internship at the day center for dementia Alzheimer's on Reynolds Road. I don't remember. I don't even know if it's still there. But and I had a little table of women, and we all cooked chopped up fresh salsa. So I passed around the cilantro and had them smell it, you know, eat a little bit of the tomatoes. And that just really got them involved and interested in what I was doing. So that was really fun.
Hey, Rachel,
So again,
can I ask a question? Sorry. I was wondering your thoughts and input on like mobile meals and what is it, meals from Moms for Meals or whatever. Like your thought on like how those are for people. Are they good for people, healthy wise, or? Okay.
Yeah, they're great. And they offer a variety of different diets. So if you have kidney failure, you know, cardiac issues, diabetes, I think they're great. And I just recently met with them and had a patient who I got started on them. And it's like the HelloFresh meals, you know, now they really have to compete with them because that's another option too. So
Yeah.
they're really good. I think they're great. And they, you know, it also offers someone to check in on the person as well, which they
Right.
love. So I am all for it.
Thank you.
So emotional changes. So, you know, loss of home, quitting their job, interest, their independence, so their license can cause depression, and that just naturally causes them to lose their appetite. So really checking in if they do have any deficiencies. Vitamin B6, B12, folate, and iron deficiencies can contribute to depression. So getting supplementations for those. So dementia is one of the leading causes of weight loss and nutritional problems for older adults. Memory loss, disorientation, combative feeding behaviors, and appetite disturbances can all contribute to weight loss. So how do we deal with those? So beginning stages, impaired memory and judgment can lead to not completing meals, forgetting to eat, or eating the same meal twice. And then that can add into increased agitation, which actually increases calorie needs, and the calories needs are not met in the first place, so that can contribute to weight loss. And then eventually individuals may refuse to eat or be unable to swallow. So, so here's a couple tips for eating. Finger foods, you know, cutting out as many steps as possible is necessary. So finger foods, cutting out the forks that they aren't able to hold. Special utensils, they can get plate guards, you know, kind of if they're scooping up a meal, they are just rubbing it all over the table, getting it off the plate. The plate guards are helpful for that, or even like putting soup in a mug so that they can drink out of it instead of using a spoon to eat soup with. Putting foods together that stick to each other, so casseroles, you know, scoop up the mashed potatoes with the chicken fingers, pork chops with applesauce, or even melting cheese on top of foods, whether it's pasta or potatoes, so that they stick together a little bit more. That could be helpful. Making sure their, you know, meal setting is all open and ready to go for them. And then making mealtime a routine. So the same place, the same time every day, or at least in, you know, specific intervals so that they know what to expect. And then also having the main meal, you know, the dinner meal, which we usually assume is the main meal, at noon. So appetite is usually increased and mental abilities are at their peak then, so might help with their intake. Offering fewer choices. So, you know, don't give them a whole bunch of fruits and vegetables to pick from, just pick that and offer it. Or serving one food at a time even can be helpful. So whether, you know, it's not a 4-course meal, it's just a 4-item meal that you serve one at a time. Be ready for messes. You know, people may spit out food if they're not able to chew it, instead of just saying, you know, I can't chew this. Choking is a big risk, but also knowing when to consult the doctor before malnutrition becomes a risk. So even if it's the beginning stages of this, you know, okay, what can we do about this? Knowing when supplements are necessary. So if they're not eating what they should be, or if they're having any weight loss, then stepping in and offering supplements, whether it's like a boost or ensure kind of supplement that just gives more calories and nutrients. They can use it to take their medications with, So it's not even, adding in an extra step throughout the day, but just kind of changing it out and getting in more calories that way. So there's the MIND diet, which is the Mediterranean diet intervention for neurodegenerative delay. So this was kind of studied and found to help to reduce the risk of Alzheimer's by up to 53%. So it's a combination of the DASH diet, if you've ever heard of that. So dietary approaches to stop hypertension. So basically limiting salt intake, lowering fats and added sugars. And then the Mediterranean diet, which includes involving more healthy fats, so healthy brain fats, more plant-based foods as opposed to animal-based foods. So all of that overall has been helpful to decrease Alzheimer's risk, but also I'll show you like the 15 steps of it. But any of those, making any of those changes can help slow cognitive decline and then improve verbal memory. So even if people only did 9 out of the 15, they saw a change. And older adults whose diet most closely resembled the MIND diet had brains as sharp as people 7.5 years younger. So here's all of the factors there. You can kind of look over those and see where you're at with that. And a lot of it, like I said, is cutting out the bad and replacing it with more nutrient-dense foods. So, less than 5 pastries or sweets a week, less than a serving of cheese, using olive oil, which has healthy fats in it for cooking, nuts, again, healthy fats. That was interesting. And also another thing that affects intake in older adults, economic changes. So many older adults are on a fixed income. I'm sure many of you guys are familiar with managing that within there. So they might have to pay for more medications, or maybe as they get older, they need assistance with other things and they have to pay for those as well. So they're usually not going to divert from what their usual groceries are. So they don't get much variety. So looking at other options for protein, which is usually the most expensive, using nuts, chicken with the bone in is usually cheaper than like boneless, skinless. Peanut butter is a good source. Eggs, beans, and cottage cheese are all good protein sources as well. So as we age, our immune system is not as efficient. So many, like if people are on medications for a autoimmune disease, it can affect your immune system. So the risk of increased foodborne illness. And as you age, your symptoms would likely be worse. Many people end up in the hospital if they get a serious foodborne illness with nausea, vomiting, diarrhea. All those factors can lead to dehydration and malnutrition as well. So also, I didn't even think about this, also altered sense of taste and smell. So, we smell milk and it's bad. We know that, but they may not know that. So they drink it and that can also cause a foodborne illness. So food safety is huge in the elderly, making sure that foods that you use first, if you buy another jug of milk, put it in back of the one that's already open. So they use that one first. Washing hands frequently before and after cooking, getting rid of damaged or expired foods. Sometimes they are not paying attention to all the cans in there. And, we all do it too. And, oh, we haven't used this in a while, I should cook with it. But it's already full of foodborne illnesses, bacteria. And then making sure to maintain the refrigerator temperature at an appropriate temperature below 40 degrees. I just read a story or saw a patient who continued. She had come in with nausea, vomiting, and diarrhea, lost about 12 pounds in the past 2 weeks, and no one could figure out why. So her grandson went over and we called the grandson and asked him to, see if there was anything going on. So he checked and noticed that the refrigerator had a funny noise. So she said, oh yeah, I hear that all the time. It keeps me up. So I unplug it at nighttime. So for about 8 to 10 hours at nighttime, she was unplugging her refrigerator, and all that food was, getting above 40 degrees and causing her lots of foodborne illnesses. So lots of bacteria growing on there. And once they figured that, he got her a new refrigerator. She was fine. So things like that, you got to pay attention to as well. So choosing a healthy diet, encourage, like I said, a variety of foods, colors, shapes, sizes. Follow the USDA daily food plan guidelines. So My Plate is a very good website. The USDA puts it out. And for every calorie level, it tells you, like we saw, how many fruits and vegetables, helps to really individualize food plans. If you want to just get on there and play around, you can even attach it to your Alexa. So if an elderly person has an Alexa that their family member got them, or they can tell her what they ate, and she'll kind of map it out where they're at with their food guide. Avoiding empty calories, so as many nutrient dense foods as possible. And then, if you're normally used to eating something sweet at nighttime, maybe, if you have developed diabetes, just identifying, I just want something sweet. I don't have to have this cookie all the time. So strawberries or other fruits, that might be a better option. And then also really, not limiting foods that people love. I mean, that's half of what I do, is work with people and have to tell them, you need to avoid these foods, but also I love finding what they like and how they can still eat that. And if a diet is getting too restrictive, where the individual can't eat anything or is really confused by what they can eat, just it's worth it to liberalize it and take off the restrictions if it's a matter of them not eating. So if the appetite does decrease, so having the main meal earlier in the day, encouraging smaller frequent meals, have special events, really celebrate a person, an event. There's a basketball game on, let's have a meal, really celebrating that, because that's really what having meals with each other is all about. And then allowing enough time for meals really also is essential, especially for older adults. They want to sit down, they want to enjoy it, maybe have conversation. So not rushing them through it. Keeping the physical surroundings pleasant, and then encouraging daily physical activity to continue to get their appetite going. So mealtime. So again, maintain a routine, eat well-balanced meals, alertness to any nutritional problems, whether it's choking, digestive issues, eating less, sticking with light and frequent meals, making sure the caregiver knows how to have a meaningful meal with the older adult. Looking for interactions between drugs and nutrients. So, if they're not supposed to eat within 2 hours of taking this medication, make sure they abide by that. Minimizing confusion for the older adult, so keeping things the same. Encouragement, and then supplementing the diet when necessary. Good. Any questions?
Rachel, can we share the PowerPoint with people?
Yes, I can send it over.
Okay.
I think it was excellent. Jason asked all the questions, which were good. They were on point. It's what we needed to know, and I appreciate that. The extra water, how much water should they take in? Is there such thing as too much?
Yeah,
that was awesome.
Does anybody?
Oh yeah, I have a quick question, Jason. Rachel, I was wondering, I don't believe you highlighted vitamin E, but I had a caregiver in the past whose husband had dementia, and the caregiver was pretty persistent and believed that the vitamin E was, improving this person's memory. And I think I couldn't remember if that was something that people thought in the past, or do you have any information? I guess I'm curious of what you think about vitamin E, if that makes sense.
Yeah, that's not one that is commonly related to mental health that I had found. Yeah, I couldn't tell you that.
What does vitamin E do?
It's an antioxidant. It is used in a lot of other processes, so it's used as like a precursor to a lot of things.
Yeah, a lot of times people use it for their skin or wounds or healing. Like vitamin E oil. It's really hard to get just 100% vitamin E oil too. That's something that's really hard to get.
Yeah.
But as far as like a supplement, a dietary supplement?
You can, I mean, I think, George, you can even look on your multivitamin that you have, if it has any vitamin E in there. It's not usually needed to be supplemented. I don't
Yeah.
know that it's.
The vitamin E that I've got now, it's a men's vitamin for 50 plus, which I just made to pass that. Anyway, it gives me 180% of the daily recommended.
Yeah, so it is
So-
usually in multivitamins.
Thank you.
Rachel, I have a question. I don't know if you guys can. In the very beginning of your presentation, you had mentioned how people are living like in nursing homes or congregate settings or whatever, how they weren't getting the nutrients. And I would think, okay, they have dietitians there and all of that. Is it because they just don't, it's not appealing to them? That's the taste and smell. I just found that interesting how you're saying they're the ones that were really lacking, where those of us that just are having to work with 1 or 2 people in an apartment, is it just the environment? I don't know, I just found that interesting.
Yeah, usually as far as like nursing homes go, if they are newly in there, you know, they need to be there because they're weak or because there's another issue. So if the malnutrition at risk probably stems from that other issue. But also, yeah, it's not their home cooking, you know, it's a change for them. So that's another issue. And it's a mass produced meal. So, you know, they're not as delicious as they could be, I guess. But they do really, I mean, encourage supplements. They have a lot of other protein options. So they do try to work with them, but yeah, for those other reasons, that's why your health is usually lower.
Okay, thanks.
Looks like Dolores has her hand raised. Dolores, if you want to ask a question.
Yes, please. I have become more conscious of what is in the foods that I purchase and what I buy. And I have just kind of found out that gluten does affect my body. So what I've been doing, it takes a lot more time to shop in the grocery store, but I've been kind of watching what has gluten, what doesn't. But you really have to be conscious of reading, because I did find out, I've never had that gluten allergy test done, but I can tell when I eat anything with gluten in it, which gluten is in baked goods and everything else. So I kind of read now what's in it. And if it has any type of wheat gluten or gluten in it, I just try to get a substitute or change. And my body really does feel a whole lot better than it was feeling like 2 months ago.
Yeah.
So I've been more conscious of reading what's in what I buy now. It takes a little longer to shop, but I feel a lot different. My body feels different.
Yeah. Yeah. Gluten's interesting. You know, gluten is a wheat protein, so it's in anything that has wheat in it. But it's also, you know, sometimes like different seasonings or preservatives have a gluten base to them. So you have to read the ingredients, and yeah, you must have a gluten intolerance or allergy, or maybe even celiac disease.
Well, I know that I feel better when I know that gluten. And then even if you buy the gluten, which I have done occasionally, but I just don't eat as much of it. You know what I'm saying? If it's in the bread, then I'll eat a half a slice of bread. I won't eat the entire piece of bread, you know, because it's in everything. And then as far as vitamins, what I've done for a long time is I will go to the doctor and he'll do blood work for me. And then he'll tell me, well, you're low in this and you're low in that. And then he actually tells me how many milligrams to buy of certain vitamins, because I never go out and buy vitamins just because, you know, so many milligrams. I want to know how many milligrams my body really needs. So I go and get blood work done, and then my doctor tells me, and I feel more comfortable like that.
Yeah, that's officially how you should do it. Why would you take something if you're not deficient?
Right.
But yeah, that's good. Good.
And your presentation was excellent. I enjoyed it.
Thank you.
Absolutely. And we are at time right now. Rachel, thank you so much for this great presentation, answering all these questions. I'll plan on forwarding out the PowerPoint after I get it from Rachel, if that's okay. And we appreciate you're there. If anybody wants to stay on for another second or more, if they have a question that just can't wait, but otherwise we'll go ahead and close out for today. Thanks for being here. And any of the certificates, probably give me about a week and a half to get those done. We've got lots of certificates we're going through right now from other presentations, but thanks for being here, and see you next time.
Thank you.